I know that this presentation is actually beyond my subspecialty, but I'm faced with patients with such problems, and I have to find a way for making them away from this bad psychological behavior, from one with the recurrent resistant corneal perforation, and the second with what we call a disfigured eye. So, because we are a country with limited resources, as the corneal grafts, as all of us know, it's very expensive for our patients, especially those who has these recurrent perforations are somewhat poor, and they cannot afford having corneal grafts easy. So we have to prepare them first to stop the aggression of this perforation, and this induces a burden for blindness. And the primary purpose of this surgical intervention is to restore the tectonic support of the eye. These interventions includes so many things, and I think the professors here are more experienced, more than me in this. But I choose the tenon patch graft to be a very simple way for treating these conditions. The advantage of tenon patch graft is no need for buying or storing tissues. It's harvested from the same eye of the patients. It starts with harvesting the graft. Small cut is made in the conjunctiva, 2 millimeters from either superior temporal or superior nasal. You dissect the tenon in the usual way, and you secure it. You put the tenons overlying the perforations, and you secure it with either a box-like sutures, as we see in the video coming now, or to use the infinity sutures or the 8 figures. And then once the graft is secured in position, you fill the anterior chamber with OVDs, and any iris adherents should be dissected from the perforations. And once the anterior chamber is formed, the side port is hydrated and bandage contact lenses is used. And we receive in this video, we dissect the conjunctiva, and we get the tenons out. Taking consideration to have a sufficient amount of tenon, it should be 1 millimeter from all around the perforation. And so we place it, and we open the anterior chamber with a super plate and put viscodispersant to reform the eye. For the sake of time. And then we make a box and 8 figures, or the infinity figure sutures. We trim the tenons as much as we tighten the sutures, and we assure that it covers the perforation. At the conclusion of surgery, we put a bandage contact lens. In post-operative care, it passes as usual, steroids given in a tapering manner, and antibiotics. This is after 1 week. This is, and the other one is after 1 month, and the 3rd month, the 4th month, and this is the 4th month, and this is the 5th month. And we can see that the perforation has been completely closed, and the tenons regressed. Yes, there is a scar tissue, but we saved the eye, and it's now prepared for doing a keratoplasty whenever possible. titanium patch graft does not require the backup of eye bank. It's cost effective, making it a viable option in a country of limited resource, and the decreased vascularization, lack of tissue-related rejection give an added advantage for it. And the second presentation is about the blind, disfigured eye, like this young lady. We know that the diffuse permanent corneal opacity is challenging, and it adds a very bad psychological feeling. So keratopigmentation may be done in an easy way. It's known since a long time, since Paris, and the techniques may be superficial or lamellar. Superficial, just to use a syringe with the dye, and the automated, which is actually is a product of Alicante in Spain, and the lamellar, usually this needs good corneas. It is a scarred cornea, but you can't dissect it. The material is available. You can get it from the libraries. It may be of a good quality or a little bit good quality, but all is doing well. Technique manual. You take 1.5 ml from the ink in a glass or a silicone container, and you put it in the autoclave. Take 1 ml with a 27 gauge syringe and start the injection. It's very simple, like that. You inject, you choose the sites where there is scarring, and you inject it until you finish with this picture. But astonishingly, after that, you see what it has been changed completely, and the next day she is very, very happy. She thinks that she is not this lady. So I think that this is a very good approach. What about the electron microscopy of these cases? The electron dense granules within the keratocytes and between the collagen fibrils. The complications, you may have a globe perforation if you are not adopting the proper technique, the corneal infection, recurrent inflammation, late fading of the dye. You use the syringe, which we use it in intravitreal injections. It should be a small one and sharp and can easily enter the cornea. The outcome of a retrospective study done by ALU, 136 eyes showed high potential satisfaction, although some needs retouch, because the dye may fade after years. Maybe 1, 2, 3 years that may need retouch. In conclusion, superficial keratopigmentation improves the cosmetic appearance of the disfigured blind eye. It's easy to perform and cheap, making it very acceptable procedure in countries with limited resources. Thank you very much.
Thank you so much.